Hello and welcome to the Prologue to Wellness podcast. I'm your host Cheryl, and today we're going to be diving into a topic that everyone is really concerned about, which is staying healthy during the influenza season. Recent news has shown that the flu is really more than just a minor inconvenience. We've seen people rushing to get their vaccinations done, and today we have Dr. Odelia with us, who will be able to share with us about how we can remain healthy this flu season. Hi, Dr. Odelia. Welcome to the podcast.
Hi, thanks for having me here today, and I'm really glad that I can share a bit more insight on one very hot topic that's going on in the recent news. So I think, as you know, and you rightly pointed out, yes, this is something that's on the mind of many people.
And Dr. Odelia, what is your area of expertise, if you may share with us?
So maybe to begin with, my name is Dr. Odelia. I am the medical director and a family physician at Prologue Lifestyle Medical Clinic. My area of interest is in family medicine, preventive care, health screening, and also lifestyle medicine.
Nice.
So what we're talking today is very much in line with what I'm interested in and what I strongly believe in as well.
Okay. So recently, I'm sure you've seen a lot of patients who are coming in for the flu vaccine. Can you tell us more about what's going on? Why are people rushing? And is it important to get your vaccine at all?
So that's a very good question and a very accurate representation of what has been happening over the last few weeks. So we've seen a huge surge in the requests as well as appointments for influenza vaccination ever since, I think the news was sometime in early February.
Early February, yeah,
about a celebrity who
Correct.
succumbed to the complications of influenza. So taking a step back, actually, it's a good trigger point for many people to reconsider about what to do about their health and what they can do to take charge of their health. So number one, it's important for them to get the influenza vaccination if you want to prevent getting the flu, or if you do get the flu, it reduces the complications from getting the flu. So for many, they're coming asking us a bit more about flu vaccination, whether it's suitable for themselves, their family, when to take it, and also what are the side effects as well as the
Correct.
benefits of it.
Yeah. So a friend told me this. She said that, I have very high immunity. I don't need the vaccine. Is this true? What would you say to her?
Yes and no. So in terms of immunity, so immunity itself is one of the criteria or one of the considerations for getting a flu vaccination. So strictly speaking, MOH has a guidelines in terms of who should get influenza vaccinations. So those who are highly recommended with those who are more than 65, less than 5 years old, or if you have any chronic medical conditions that places you at a higher risk of getting complications of influenza. For example, if you may have diabetes, heart issues, or asthma, or even chronic obstructive pulmonary disease. So the reason why these populations are strongly recommended to go for it is that they are at a higher chance of getting complications and more severe illnesses.
Right, okay. So the recent cases were quite shocking because people would think that it's a common flu, but it actually developed into something even, life-threatening. How do you know, and at what point should you kind of really see a doctor to say, hey, I think this is more than a common flu?
So common respiratory illnesses usually last for a few days, and there are hundreds of viruses out there. What is striking about influenza is usually you have a fever, you can get a dry cough, but that being said, it does overlap with a lot of respiratory conditions. So you will get a sore throat, or you may get a sore throat or runny nose, and you can get things like headache and muscle aches. So for the average individual, usually you recover within a few days to a week.
Okay.
Things that you should watch out for if you find that your symptoms are more severe. So for any respiratory condition, for example, you feel that the cough is affecting you to the point that you're breathless,
Right.
or you have chest pain, or generally you feel unwell, that's always best to get it checked out.
Okay. So I guess, especially during the high peak traveling season, a lot of people are kind of worried, and especially if they're going to a place that has a flu outbreak. When is a good time to get the flu vaccine if you're traveling?
So that's a good question. So in terms of preparing for a trip, usually you should try and get your flu vaccination 2 weeks before.
Okay.
So number one, that gives you enough chance for your body to build out an immune response to it, so you're well protected when you travel overseas. And secondly, for some patients, you might get some minor side effects like mild fever or aches, and that gives your body a few days to recover before you go on your trip.
Okay. On top of taking the flu vaccination, if someone is traveling, what are some of the precautions that they can take before flying?
So that's a great question. So actually beyond the flu vaccination, there are many ways that you can do to boost your immunity and to reduce the chance of falling ill. So number one, I mentioned earlier, how do you boost your immunity? So there are a few ways that you can go about doing it. Number one, make sure that you get adequate rest and also adequate balanced diet that's nutritious and full of vitamins and the nutrients that you need. So one way is to make sure that you eat your fruits, your vegetables, eat a a colourful rainbow. So that's
Okay.
how one way you can go in terms of approaching what you should be eating.
Okay, colourful rainbow, I
Correct.
remember that.
And you can go by the healthy plate.
Healthy
so the
plate,
Health
okay.
Promotion Board has come up with a healthy plate concept. So when you're going out choosing your meals, you can remember half the plate should be fruits and vegetables, 1/4 be that of whole grains or brown rice,
Okay.
and another quarter be that of protein and lean meat.
Okay.
Also drink water. So water over sugary beverages, all these will lead to you having a more balanced diet. Other things that you can look into be that of getting enough sleep. So as you know, when you're stressed or you don't get enough sleep, your immunity tends to take a hit and you may fall sick more easily. So getting enough rest and also managing your stress well, all these are helpful tips in making sure your immunity is strong. You can also look into getting masks, wearing masks, or getting adequate protection if you're in crowded places or places like, for example, in the office when there's a flu bug going on. So that can also help you in terms of reducing your chance of catching a bug. And finally, be mindful of hygiene. So as you know, this is transmitted via droplets. So for example, if you touch certain high contact surfaces or after like blowing your nose or coughing on a tissue, wash your hands, sanitize your hands, and avoid touching your face for transmission of the virus.
So with the recent flu outbreak, what are some other considerations that one should make while before travelling, perhaps?
So I think number one is to know where you're going, to know your destination, and also to know how long you're going for and what are the activities that you are going to be engaged in. So number one, I think for those who are at high risk of falling ill or those with other medical conditions, you have to consider your personal health status. So make sure that your condition is well under control, or you have spoken to your doctor about certain precautions that you might have to take pertaining to your conditions, and what to do in the event that there are certain like worsening of conditions or acute flares of your illnesses. The elderly and younger children should also be more cautious. So for example, if you're going out, you can consider wearing a mask when you're in crowded places, and be more mindful of hand hygiene when you're going out. Another thing that you can look at is to do a bit more research in the area that you're going to understand more whether there are any particular conditions or outbreak or certain conditions that you can prepare for. And I think most important is also to understand a bit more about the infrastructure, the medical infrastructure that place has. So in the event that you have fallen sick or you need to seek some medical attention, where you should go. So you can find out about certain clinics, hospitals, or maybe a local contact point. So someone that you can speak to if you need help in terms of making any of these arrangements. And also on a practical note, you can also find out a bit more about your travel insurance to see how the coverage is and how you should activate it in the event that you do need to use it.
So I have also a list of like things that I would like to clear up with you, Dr. Odelia, since we have you with us. There are lots of facts and lots of myths about vaccination.
Yeah.
So you brought up one point just now, fact or myth. Getting the flu vaccine will give you the flu.
So yes and no. So it's both a fact and a myth. The flu vaccine itself doesn't give you the flu. However, after you get the flu vaccine, there is still a minor chance of you contracting the influenza viruses.
Okay.
But the benefit is that with the flu vaccination, you are likely to have a milder illness and recover faster.
Right, okay. So you can take the flu vaccine, you might get some symptoms, but that's totally
Usually it's
okay.
minor.
It's minor. Okay. Fact or myth? Pregnant women cannot take the vaccine.
Oh, actually they should.
They should.
So pregnant women should get.
No matter which trimester they're
that's
in.
okay, yeah.
That's okay.
Yeah.
Okay. Fact or myth? My child under age of 5 should not take the vaccine.
They should, in fact. So it's actually part of the National Immunisation Guidelines. So, in fact, the government has afforded subsidies for anyone less than 5 years old.
Right.
So, as long as you're more than 6 months, you can get the flu vaccination already.
Fact or myth? I do not need to wear the mask because I've taken the vaccine.
So that's a myth. So number one, the mask can also protect you from other respiratory illnesses. And also if you're unwell, it's also a good idea to wear a mask so you do not transmit any viruses. As we spoken earlier, the influenza vaccination is not 100% protection. So you still need to take certain other precaution measures to even reduce the chances of getting the flu or any common cold.
Okay, fact or myth? I have a chronic condition and I'm taking medication on a regular basis. Therefore, I can't take the vaccine.
So that's a myth. So in fact, if you have chronic conditions, especially those that may compromise your immune system or place you at higher risk of complications, you should get the vaccination.
Okay, just check with your doctor, I suppose.
Yes, correct. So you let your doctor know about your chronic conditions and your medications that you're on. One exception is that if you're unwell. So if you're acutely unwell, for example, you have a fever, then that might be a better idea to hold off the vaccination until you're well.
Fact or myth? I do not need to take the vaccine because I've taken mine 6 months ago.
So it depends which population you are. So if you're an average Singaporean, then
Healthy.
once a year healthy, once a year is good enough. But for example, if you're in certain higher exposure populations, for example, you're a healthcare worker, then you can get it every 6 months if the strains are different.
Okay. Fact or myth? The vaccine is the only way to prevent a flu.
So that's a myth. There are many other ways that you can help reduce the chances of getting influenza. So number one, good hygiene, that's important. So for example, wash your hands regularly with soap, with water, or alcohol-based hand rub. When you are out and you're unwell, when you can blow your nose or cough into a tissue and throw it away, and do hand hygiene after that. When you're feeling maybe a bit under the weather, you can wear a mask, so that prevents the transmission as well. More importantly is to keep yourself generally healthy. Keep your immune system high, so things like making sure that you have enough rest, hydration, and eating well. Those are very important if you want to prevent getting the flu.
Okay. So if someone is almost, when you have that feeling that you're almost going to get a cold, almost going to get a flu, is there like a quick fix that you can do?
So number one, rest. Rest, hydrate. Majority of time, right, they are caused by viruses, and your body has the immune response to recover and to respond to it. But you do need to give your body the chance to do it. So hydrate, take the rest that you need, take any symptomatic relief to help you feel better, and you will feel better soon.
Okay. Before we end today, maybe if Dr. Odelia, if you were to offer some tips for someone to stay healthy during the flu season, if you have your top 3 tips, what would you say?
So number one, get vaccinated, because that protects you as well as your loved ones. Number two, stay healthy. So you can do that in terms of eating well, getting a regular physical activity, having good sleep and stress management, all essential for you to be able to have a good immune response. And number three, if you're unwell, rest. You can stay away maybe at least 24 hours until you feel better, and wear a mask when you go out.
Okay,
Yeah.
cool. Thanks, Dr. Odelia, for those valuable tips. So guys, remember, number 1, take your flu vaccine. Number 2, stay healthy. Number 3, rest when you need. That's all we have for today's episode of Prologue to Wellness. At Prologue, we believe that healthcare deserves a new narrative. Till then, take care and be well.